And welcome to the Dr. Bob Show. We'll be spending most of this show talking about urinary incontinence, both in men and in women. Boy, we certainly have come a long way in the last 25 years we've been doing the Dr. Bob Show. We used to never talk about incontinence, both women and men. It was sort of a private thing. Now, when you're together, everybody's talking about, yeah, when I run, I've got it. Yeah, when I cough, I've got it. And men say, yes, I even have leakage too. We'll be spending most of this show talking about how we can improve or get rid of or fix urinary incontinence. My guest is Dr. Chris Ramsey. Dr. Ramsey is a board-certified urologist, and he deals with this problem every day. He'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about how the pulse can tell thyroid problems, heart problems, anemia problems. So it's important for us to know how the pulse helps the doctor and how we can take our own pulse. And later on, what is the spleen and what's the function of the spleen? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Chris Ramsey, board-certified urologist, and we're talking about urinary incontinence. Chris, welcome to the Dr. Bob Show.
Thanks for having me.
Everybody knows about the words of urinary incontinence, but from your standpoint, what's your explanation of urinary incontinence?
That's basically leaking urine involuntarily when you didn't want to urinate. And that's the basic.
Happen in both men and women?
Absolutely.
What's most common, men or women?
Most commonly in women.
How much more common? 80-20 sort of thing?
Probably 75-25.
Okay. So let's get with women. Why do women have more incontinence than men?
Well, probably because women don't have children, and the support structures to the bladder and the urethra are not as strong as they were as they get older.
How about the length of the urethra?
Absolutely, yeah. The length of the urethra is also helpful in a man. The man's urethra is longer, so there's a little more pressure to help prevent leakage. Also, a man has a prostate, so that also helps prevent leakage. The women's urethra is a lot smaller, and so it doesn't take as much pressure to cause leakage of urine, especially if you have a full bladder.
Are there different kinds of incontinence that women have, or is it just one thing? It just leaks?
Right. Well, it does just leak, but there are several different types of or causes for the leakage. The most common cause that we see is stress incontinence, or if you cough or sneeze or laugh or do jumping jacks, jump on a trampoline.
So that's pretty common.
That's very common.
And that's if you cough, boom, it puts pressure. Does it just the whole bladder empty, or is it just a little bit at a time?
Sometimes it can be a lot. Sometimes it can be a little. It really depends on how severe just your symptoms are.
So that can be very embarrassing. That's stress incontinence. Right. What other types of urinary incontinence in women are there?
There's urge incontinence, which is a woman who has an overactive bladder, a lot of urgency and frequency, and just can't get to the bathroom in time. We see a lot of commercials about those medicines that help with that.
Is that a common problem?
It's very common as well, especially as you get older.
And so, especially as you get older, and I notice myself, sometimes I have the urge to go, whereas I didn't when I was a young pup. So that happens in men, but in women it's very common too.
Right.
It's an overactive, irritable bladder. What other causes?
So there are neurological causes. People have MS, people have diabetes, people who have back disease, spinal cord injury patients can have neurological problems where the bladder doesn't work as well. It can become overactive, or it doesn't empty, and you can have overflow leakage where the bladder is just so full that urine just comes out almost like water over a dam.
So are there things that we can do about all these?
Well, there are a lot of things you can do about it.
Let's talk about stress incontinence, because that's the one that I hear when people are talking about it. It's when they run, when they cough, when they sneeze. So let's talk about it. You tell me about that.
So stress incontinence occurs when you cough and sneeze and laugh, and the support structures to the urethra and the bladder aren't as strong as they used to be.
The support structures, what are the support structures?
Basically the tissue within the vagina. There are muscles and ligaments and tendons that help to lift the urethra and support the urethra so you don't leak on yourself.
So where is the urethra in relation to the vagina?
So it's right at the outside of the vagina. It's on the top part of the vagina.
Okay, and when you look at the urethra, and as a urologist you have to look at that, what does it look like, just the urethra, when you're examining a woman?
Kind of a small hole, not very much bigger than a small button.
So that what happens is then with stress incontinence, what happens?
The urethra may lose its support and drop down, and it loses pressure underneath the urethra. So when you cough and sneeze and laugh, urine will come out because there's not enough pressure in the urethra to keep the urine in the bladder.
So you have to plug it up? What do you have to do?
Well, there are conservative treatments. Oftentimes you try to do conservative treatments. You don't want to rush off to surgery. Kegel exercises or pelvic muscle.
How do you Kegel? K-E-G-E-L?
That's exactly
Kegel
right.
exercises?
Right.
What are those? Walk me through those.
So a Kegel exercise is when you squeeze your bottom, basically like you want to stop urinating, and that's a Kegel exercise. So we teach women how to do different types of Kegel exercises to make that muscle stronger to maybe help hold back the urine.
Is it a new learning? Is it a new bunch of muscles? Or we all try and not have incontinence, so we all know how to try and hold it? It's the same thing.
Most people know how to activate a Kegel exercise. We just need to teach you how to do it efficiently so that it can be helpful. It only works about 50% of the time, though, and you have to continue to do it. So most people don't do very well with Kegel exercises.
Okay, so the reason is non-compliance. They don't do it enough.
Exactly.
But it can help.
It can.
So after conservative, then what are the other approaches we have for stress incontinence?
So there's surgeries to help with stress incontinence, a sling procedure. There are several different types of suspension procedures for the urethra. Some are older that we use with abdominal approaches, small incisions in the belly to lift the urethra up to the pubic bone. It's called a Birch procedure. There is a pubovaginal sling, which is a very fancy word.
Pubovaginal sling. Now, so we're talking about urethral slings to support the urethra. Is that the same type of mesh? You said that's mesh. Is that the same thing as supporting the bladder?
So that's a little bit of a different procedure than the mesh. It's using a piece of your own muscle, or sometimes people even use pig muscles or even cadaver muscles to lift the urethra or the bladder neck, and you support it to the pubic bone. And then the newer procedures are the slings procedures with mesh.
Okay, and how is that done for the urethra? Because I know one patient that had that, one of my nurses as a matter of fact, and it was amazing. She did so good. Tell me about it, because you don't have to go in the hospital and have big bed surgery?
So it's about a 10-minute outpatient procedure. You do go to sleep.
10 minutes?
10 minutes.
You do go to sleep.
Right. You make a small incision underneath the urethra, maybe a centimeter or a third of an inch. And then sometimes you make either small incisions above the pubic bone or on the inner thigh. And you put a piece of mesh that looks like Scotch tape with holes in it, is how I describe it. And it goes underneath the urethra, and then we put
so you sling it underneath. You sling it underneath,
right, kind of like a hammock,
and sort of pull it up a little bit.
Well, you pull it up, but you don't want it to have any tension. You don't want, because it can put the patient into retention where you can't urinate. So you have to do it without tension, and the body actually incorporates that mesh into the vagina, underneath the urethra, and that's where it gets its long-term support.
So my nurse that had it said it was the best thing. She couldn't believe how good it was, that it's worked really good. What are the results you get in most people with this urethral sling?
So 90% or better success rates where you're cured. 1 to 2% may not have any improvement at all, which is a very low risk. Most people, if they don't get better, the other 8 to 10% may have a lot of improvement, may not be perfect. And so it's a very, very safe, effective, quick, and easily to recover from.
Now, is it 100% when it goes through? Are they just a whole lot better usually?
90% are cured.
Wow. What age group responds mostly?
Any age group. I've had patients in their early to mid-20s to patients in their 80s.
Okay. Which one, I would think, the vaginal tissue and the support tissue would be better in a 30-year-old that had had 2 kids than an 85-year-old that had had 2 kids and it's getting older.
It may be, but all those patients seem to have very similar success rates.
Wow, that's absolutely. They must think you're their hero.
Well, I get a big hug on my neck sometimes.
That's great. So, are there other kinds? That's a urethral sling. What else would you do for the stress incontinence?
Those are pretty much most of the options that we have available. There is so for some of the patients who don't have perfect results, there is what some people may call a filler or a bulking agent, and that's a very quick procedure, sometimes even done in the office, where you put a scope into the urethra and you can inject a bulking agent to increase the pressure on the inside of the urethra, and sometimes that can help kind of fine-tune the leakage if it's not perfect.
Now, you mentioned other kinds of urinary incontinence. Is there good treatment for that?
So the other types, we talked about urge incontinence.
And that's what we're going to be talking about when we come back. Urge incontinence, overflow incontinence, it's amazing. A lot of information for you. You're going to want to stay tuned. We're talking with Dr. Chris Ramsey, board-certified urologist, and we're talking about urinary incontinence, something that we all talk about now, something that is not to be ashamed about, it's to take care of. We've talked about stress incontinence with coughing, with laughing, with straining. We get a little bit of leakage, and it looks like there's a urethral sling, a little sling that goes under the urethra to give it support and 90% effectiveness. Is that about right?
That's exactly right.
So let's talk about urge incontinence, Chris. What is urge incontinence?
So urge incontinence occurs when there's a misconnection between the brain and the bladder. And the bladder's job is to squeeze and empty. The brain's job is to tell the bladder to relax, slow down, don't empty in inappropriate conditions, in social situations.
That's right.
And sometimes, because of either a neurological problem or as you age, it's not a normal thing. There can be that misconnect, and the bladder will start acting on its own.
Is that misconnect? Is that the entire bladder disconnects, or is it a urethral trigone? Or
this is mostly the entire bladder that's affected. The bladder muscle isn't told to relax, and it starts to squeeze on its own.
That should be very, very difficult. What's the treatment for that? How do you correct that?
So Kegel exercises that we talked about earlier can actually help with that too.
So you tighten down, you strain down so that urge doesn't...
Well, actually, every time you squeeze that muscle, your bladder sends a message to your brain that says, I'm not ready to go to the bathroom. And your brain will send a message back to the bladder that says, relax. So sometimes that can be very helpful.
So we can Google Kegel exercises. We can get Kegel exercises from the urologist, but you got to do them or they don't work.
Right.
So that urge incontinence, if we do Kegel exercises, anything else?
So everybody's seen the commercials for overactive bladder medications, and there are probably 5 or 6 that are readily available.
Do they help?
They help quite a bit. For most people, they help.
Bad side effects?
Some of them have some side effects of dry mouth and constipation, which both of those can make the urinary issues worse. If you have dry mouth, you're going to drink more. Constipation can actually cause the bladder to become more overactive. A newer one doesn't cause some of that. But it does.
What is the newer one? What's the name of it?
The newer one's called Mirabetriq. It's a new one that...
Say it a little slower. Mirabetriq?
Mirabetriq. Mirabetriq. And it has fewer side effects on the bowel and dry mouth. Sometimes you can have kind of a racing heart.
So there's no free lunch. Every medicine has some side effects, but there is a new medicine that can help. Do you have to teach people, don't let your bladder fill up so much?
Timed voiding. That's one of my favorite things to talk to women about. Don't go more than 2 or 3 hours, 4 hours max. Sometimes people can't even last that long.
Do you find people always wait till the last minute?
A lot of women do.
So when you're near a potty, use it?
Hopefully that's what we try to do, so you don't have to go to every potty. Most women who come in say, I know where every bathroom is in Walmart and Target. I know where they all are. And I want you to not have to find out where all the bathrooms are.
Okay, so you need to take time for yourself and for your bladder and to empty the bladder, and that will help the urge incontinence. Now, I think very, very serious is that more serious forms would be neurogenic. You said multiple sclerosis, some spinal cord,
disease,
Parkinson's.
diabetes, all those things can potentially affect the bladder.
So how do you treat that?
Well, there's a new, I say new, it's probably been out for a little, more than a decade now, but there's a bladder pacemaker that actually helps to take the control of the brain into the bladder, and it slows the bladder down and can help with some of the urgency and frequency and help with emptying the bladder. That's one of the later things that we do after medicines don't work and Kegel exercises don't work. Some women end up having to learn how to catheterize themselves because the bladder does not empty. And nothing that we do helps with that. The bladder doesn't squeeze.
So is it frequent that you teach women how to catheterize themselves?
In my practice, it's not infrequent. We have to do that quite a bit, at least several times a day, but it's not a common thing in most women, fortunately.
So every time you catheterize somebody, you're sort of dilating up the urethra. Aren't you making the problem worse?
You actually use a very small catheter that doesn't dilate at all. Just slip the catheter in, drain the bladder, and pull it out.
And that's predominantly in somebody that's got neurologic problems, or you have to use that in other people that just can't empty their bladder all the way?
So mostly with a neurological problem where the bladder just doesn't squeeze very well.
So there's things that you can do for stress, there's things that you can do for urge, there's things that you can do for neurogenic. Now, how about what's an overflow? What does that mean?
Well, overflow typically happens with an obstruction or with the neurogenic bladder that doesn't empty. So when the bladder gets so full that it reaches its capacity and urine will just come out.
Wow. And the treatment for that?
Oftentimes has to be, well, all the things we've talked about, and you have to go down the list.
You must say that 1,000,000 times during the day. So women with urinary incontinence, the way I'm hearing it, there is so much that we can do for that. If you've got it, you need to see your doctor and need to see the urologist, and the urologist has seen it before and will know how to take care of it. Let's switch over to men.
Okay.
Men have urinary incontinence too, not half as common as women. Why do men have urinary incontinence?
Most of the time we get to blame the prostate for that.
So tell me about the prostate. Where is it? What does it do? And how does it cause, how do we blame that on incontinence?
So the prostate's between the bladder and the urethra. It's the male sexual organ. It's what activates sperm so that we can get women pregnant. But as you get older, it just becomes more of a pain in the rear than anything.
So
as it gets larger, then...
how can you tell if it gets larger?
Well, the patient themselves can't tell if it's getting larger or not. You present with symptoms of difficulty urinating, urgency, frequency, weak stream, peeing on yourself.
How weak is the stream? When I'm at a ball game and I go into a men's bathroom, they may stay at that urinal for 5 minutes or so. It seems like they never get through urinating. Is that the prostate?
So that is most likely the prostate.
So if somebody's got that problem, they can't void and the prostate's bothering them, what do you do for that?
We first try to start with medications that help to relax the prostate to give you a better stream so you empty your bladder better so you don't go as frequently and you have less problems with the leakage.
What are some of those medicines?
So the older ones that we use now are Flomax.
Flomax?
They're all very similar in the same family. Flomax, Uroxetrol, Rapaflo is a newer medication.
The side effects?
Side effects, dizziness. And runny nose sometimes. And one of the side effects for younger men who are sexually active can have what we call retrograde ejaculation, which means when you have intercourse, nothing comes out.
So it goes backwards.
It goes backwards and you urinate it out later.
Tell me about how you treat it with medications. Men, if they have leakage, if it's really bad and the medicines don't work, are there any surgical procedures that you do for men?
Most people have heard of a, quote, rotor-rooter or a ream job, which is a transurethral, so we go through the urethra with a scope, and we remove the inner part of the prostate. And kind of the way I describe it to men is you take the core out of an apple to open up the stream so that you can urinate better and have a better stream and empty your bladder better.
Do you completely evacuate the prostate? It's got a capsule.
Right.
Do you completely ream out the core of the apple?
Just the inside part of the prostate. We don't remove. We may remove 10 to 20% of the prostate.
So if the urethra comes through the prostate, how do you circumvent that? How do you avoid the urethra?
You have to cut through the urethral tissue, and that actually most of the time, 95% of the time, will grow back. Sometimes scar tissue can form, and that can lead to other problems and blockages that have to be treated.
Sure. Again, there's no free lunch. There's side effects to everything. How effective is urinary incontinence treatment in men?
So very effective as well. The medicines work most of the time. When the medicines don't work, or if over time you have problems with the cost of the medicine doesn't work, it has bad side effects, or you're just tired of taking medicine, that's when we go to the surgical treatment.
Chris, you blow my mind with all the things that we can do for urinary incontinence in women and in men. Any overview statement that you would tell men and women about urinary incontinence?
Urinary incontinence is not a normal thing. If you have it, go see somebody.
And see somebody, it can be fixed, most likely if they find the cause.
Yes, sir.
You're a great teacher. Thank you for coming to the Dr. Bob Show. I've so enjoyed this and enjoyed learning. Please come back with us again.
Thanks for having me.
If you've got urinary incontinence, don't be embarrassed about it. Know that lots of people have it, and then you go see your doctor about it. It's a urologist that you should see, and he has lots of things, as you now know, to fix that. You'll want to stay tuned. We're going to be talking later on about your pulse. Do you know there's 5 or 6 places in the body where you can feel your own pulse? Do you know that your pulse can diagnose other illnesses, that you can help your doctor? And what is the spleen? And what is its function? A lot of information for you. You want to stay tuned. I want to thank Dr. Chris Ramsey. Phenomenal discussion on urinary incontinence in both women and men. Don't be embarrassed about it. Get it fixed. And now for questions from you, the viewer, that I think will be important to your health. Question number 1, Dr. Bob, what can the pulse tell the doctor? Let's talk about the pulse. Every time the heart beats, it throws blood out, and we can feel that blood. Those are arteries. We feel the arterial pulse, the radial pulse. There's a bone, there's a ligament, right between there is a little valley. That's where you can feel the pulse. Normal pulse is between 60 and 80. When it gets over 100, it's too fast. When it gets below 60, it's too slow. If somebody has a pulse, where else can you feel it? There's one in the temporal artery, there's one in the neck. Never feel both arteries at the same time in the neck. You'll cut off the blood flow to the brain. In the groin, there's an artery there. Behind the knee, there's an artery there. On the top of the foot, there's an artery, and behind the ankle, there's an artery. So the best ones to feel are the radial artery and in the wrist, and also the carotid artery in the neck. Now, what can it tell you? If the pulse is nice and dynamic, if it hits the tips of your fingers right there, and you can feel it nice and strong, that means your heart is really pushing out blood good. That's what you want to feel, a nice bounding pulse. If it's sort of a weak, thready pulse, if it's sort of, you can just barely feel it, and it's going, you can feel it, it's going bang, 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 but you can barely feel it. That either means your heart's not pumping out blood good and you're not in shape, or it could mean, if it's real fast and real thready, it could be a clue to the doctor that you've got anemia. If it's bounding and fast, it could be that you've got thyroid disease and your pulse rate is fast and it's going bang, 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 bang at a much faster rate, 110. So know how to count your pulse. That will tell the doctor in itself. Know the character of your pulse. If you're having fluttering of the heart, try and take your pulse when that's happening, because you can tell the doctor if your heart is racing for a period of time, how long that time is, what your pulse feels like. If it's irregular, you can feel atrial fibrillation. If you're having bigeminy, that's a good pulse and a missed pulse, a good pulse and a missed. You can feel both of those if you really pay attention. So start feeling your own pulse. See if you think your heart is beating as strong as it should be. See what you can do to help your doctor by knowing that pulse. The other diseases, aortic stenosis. As the blood is having a hard time coming out of the heart, guess what your pulse feels like? It's real weak but real long, because the heart is having to take more time getting that blood out of the heart. If you've got aortic insufficiency, the blood comes back into the heart from the aortic valve, and so there's more. So you got a bounding pulse, a real strong pulse. So know what your pulse is, know that it can help your doctor. Question number 2, Dr. Bob, what is the function of the spleen? The spleen is in the left upper quadrant of the abdomen. It's a very important organ. It really collects old blood vessels and helps get rid of them by forming bilirubin that goes to the liver. The spleen, if it's ruptured, you can bleed to death. The spleen, if you take it out, you have to be very careful on the vaccinations that you have, because the spleen is part of your immune system that helps protect us, fight off infections. So if we don't have the spleen, then we may have to be sure that we've got vaccinations, that your doctor is very careful when you get infection. That's all the time that we have for this show. Hope you've enjoyed it as much as I have. Remember, exercise is the most important thing you can do. It almost helps everything. Get 7.5 hours of precious sleep. If you're not sleeping well, see your doctor. Eat properly. Know that you need to be sure that you don't skip your meals, but that you watch the portions that you eat and you don't snack so much before you go to bed. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. You know, we don't spend enough time sitting down and giggling with other people and laughing. So find that friend, tell funny stories, do things that will make you happy and make you laugh. The people around you will be happier. Your immune system will work better. Laughter is so important, and even Dr. Bob, I don't spend enough time talking about the importance of laughter. If you have laughter in your life, your immune system will work better. You'll be healthier. You'll be happier. The people around you will be happy. So laugh a lot and stay healthy.